So good morning, guys. You guys ready to step into the E spot with Camille?
Yo, absolutely.
Well, today we are in a self-care treat. We have Dr. Brooke Jackson, and she's going to share her expertise as a board-certified dermatologist. And I know you went to her once.
I did go to Dr.
Or at least more than once. I saw the pictures.
Yes, I went to a couple times.
Wait, she got a picture came back in the office?
She sure does.
Oh, okay. So she ain't get no picture?
I mean, well, you got to go.
I mean, I was there.
What did you have done?
We got to go in the back, though.
Well, it's HIPAA laws. Maybe you can't
whatever
tell
is perfect, you don't need anything done.
Ooh, shots fired. Came back. How you feel about that?
Well, I mean,
that's a bunch of horse.
There's nothing wrong with a little self-improvement.
Hey, I get sit done.
Exactly.
Well, I get facials.
I said, man, you 40 years old. What you doing with braces? Nothing wrong with self-improvement. I said, that's what she said? Oh, my bad. I'm sorry.
Oh,
wow.
Oh, I'm sorry.
I want braces, so I shouldn't say that. Anyway, but we have Dr. Brooke Jackson on the line. Thank you so much for joining us this morning.
Hey, how are you?
Good morning. Good morning. We're great. How are you?
How you doing?
I'm good.
That's good. Well, so let's jump right into it. How did you even get started in dermatology?
Well, dermatology is a field where you can see patients of all ages. So I see children, I see adults, and I see elderly. I think the oldest patient in my practice right now is 99 years old. And because people have skin, and you have skin your entire life. And so one of the great things about skin is that we actually get to see and transition people through different phases of their life. For example, I'll see a college kid, get them ready for their graduation, their first job, then their wedding, then I meet the mother of the bride, then I meet them when they have their first baby, and then I see the godmother and the grandparents.
Oh, that's awesome.
It's a really great way to develop relationships with patients.
So speaking of that, what are some of the top skin concerns you're seeing now?
So a lot of it kind of depends on season, and it also depends on what's going on in a patient's life. For example, I have a lot of people who are in their 40s, a lot of women who are developing acne and kind of wondering why this is happening at age 40 instead of age 15.
Tell me about it.
But it is a thing, and what I tell them is we just want to try and focus on the silver lining of all of this, and the good news is a lot of the treatments for acne will also help with fine lines, wrinkles, and help you age gracefully into your next phase of life.
Are you talking about Whitney?
Well, that's one of them.
That's my favorite friend. I use her every night.
Yeah. The other thing this time of year, because we're transitioning into the fall, is eczema. So October is actually National Eczema Awareness Month. And so we're seeing people who are starting to have some issues with dry, itchy skin, which often correlates with allergy season as well. So we're in the mold season right now, too.
So Dr. Jackson, quick question. I heard you just mention eczema, and especially coming into this time of year. A lot of times people call it, we put oil on our skins or, lotion or whatever people. And eczema, some people probably don't know that's what it is or what what are some of the signs, what's some of the things they should be looking for just to, to say maybe this is something a little bit different than just dry skin?
Sure. Well, there is nothing wrong with a well-moisturized person. I'm a fan. But with that said, eczema is in a group of disorders. And so if you think about anyone who's ever had asthma or hay fever, there are times of the year where things are just awful for them. They're sneezing, they're taking their antihistamine. Eczema is basically asthma of the skin. And so all of the diseases are correlated, and they function very similarly. So they all tend to get a little bit worse when your immune system is down. There also tend to be some distinct triggers, and so change of season is one for eczema for sure. And so dry skin is one thing, but typically with eczema you end up getting these little dry, itchy patches where you can feel them, and often if you sort of step back, you're like, oh, it's March, or oh, it's September. Things can also get a little bit worse if there's any kind of stress. And so if life is throwing you some curveballs, you can absolutely expect your asthma to get worse, expect your eczema to get worse.
Wow. That's the first time I've I don't know why I never thought of it that way, but
same.
It's pretty. Oh, I learned something.
Yeah, I had no idea. Now, what's the big difference between eczema and psoriasis? We hear a lot about people having both of those ailments.
Yeah. So they're often treated very similarly, but psoriasis tends to occur more on what we call the extensor surfaces of the body, so elbows and knees, and eczema tends to occur on the flexor, so the inside of the elbow and the inside of the knee. Psoriasis is a little bit different in that it's not necessarily correlated with asthma and allergies. Often there's a genetic component to it. And so with psoriasis, what I usually tell patients is normally your skin cells takes about 30 days to grow up. With psoriasis, your skin cells are a little precocious. They're growing up a little too fast, and they don't get the message that they're supposed to fall off. So that's why you get all these little crusty areas where a 12-day-old skin cell should not be ready to fall off, but it's just kind of hanging on to you.
Again, you're listening to the E-Spot with Camille, and today we are learning the latest on skin treatments from board-certified dermatologist Dr. Brooke Jackson. So there's a lot of different products and services that we're seeing a lot of. What really works as far as, like, I'm going to do a quick little words and you just tell me it's true or false or what you think about them, like African black soap.
Sorry. So let me back up for a second.
Okay.
What works depends on what we're trying to fix, right? So I have patients all the time who come in and say, this is not working. And my next question is, what are you expecting it to do? So a soap is really just meant to cleanse your skin. With that said, African black soap is something that is all over the place, and there are a lot of people that use it. And I am also of the school of thought that if it ain't broke, don't fix it. So if your skin is perfect and you're using African black soap, go for it. But if you are in my office because you have acne and you are using African black soap, I'm going to tell you, let's read the ingredients. Often the ingredient is shea butter and a lot of oils. Why are you putting this on your face if you have acne? Stop it.
Got it. What about, speaking of oils, what about coconut oil? That seems to be the fix-all right now.
Yeah, same deal, right? So again, if it ain't broke, don't fix it. If that is what is working for you, have at it. But if there is a problem, then we have to look at what you are using that may be contributing to the problem. So in general, people who have acne should not be putting anything which is very oily, very occlusive, very moisturizing on their face.
Okay, and then I even noticed this at your practice, that you guys have CBD-based skincare as well. What are the benefits people can expect from that?
Wow.
Well, we don't have it just yet, but it's coming.
Oh.
So CBD, where does it fit in dermatology? It's anti-inflammatory, and so that is why you're starting to see a lot of different CBD companies and a lot of different CBD products. Certainly as a physician, I'm not a fan of things that are vaped because there are a lot of issues with that, with your lungs and lung health. But I think over the next few months and few years, you're going to see a lot of CBD included in products. Now, I like to look at things systematically, and CBD, yes, it's anti-inflammatory, but if you're putting it already in a product that has some active ingredients that do what you're expecting the CBD to do, can you be sure that it's just the CBD, or is it really the product that you're adding the CBD to? And so I do think that we have to look at things scientifically. There have to be studies that are done. Does this really work? Is the CBD really a component that works? We know that, yes, it is anti-inflammatory. Your body has receptors for CBD, and so there's really a wonderful, wonderful opportunity and just a whole realm of possibilities.
That's awesome. So I also noticed that you're, it's not really a spa, it's a wellness center. So can you tell us some of the different treatment options people have for, said, like acne, hyperpigmentation, and even with razor bumps, because I'm sure those are some of the common ailments that our listeners might have issues with.
Yeah, so as a dermatologist, our field basically invented a lot of these things, chemical peels, laser procedures, all of these things. So that's why it's important to go to a board-certified dermatologist. With that said, the reason I do all of these things is they often work in conjunction with prescription products. For example, my acne patients, we get them on prescription medications, but then they often have issues with hyperpigmentation. So we're going to be doing some chemical peels. I can do medical strength chemical peels, and I also know what they are treating and what their issues are. For example, if I have an acne patient who also has eczema and very sensitive skin, the last thing I want them to do is to go somewhere and get a chemical peel where they don't understand that this person has eczema and is on these other medications. So it is really just an effort to make sure that we are making sure that everyone gets the best result and doesn't have issues from other treatments elsewhere. With that said, chemical peels are great this time of year. You obviously have to avoid sun exposure, and we'll talk about sunscreen and dark skin. Razor bumps, huge, particularly for men. It can be an issue. We do laser hair removal for that. I did a lot of the research that allows us to use lasers in skin of color, so I'm very familiar with that and its treatment. And then we're also trying to work on anti-aging, and so there are a lot of procedures that can help with that, as well as getting rid of some extra little cushioning around the middle.
That's awesome. Again, we're talking to Dr. Brooke Jackson, not Michael Collier's ex-wife. I did look that up since you mentioned that. Just a shout out on that.
Yeah, he did bring it.
I was like, I went and Googled immediately. I was like, oh my gosh, they're both from Chicago.
I know they're both from Chicago. I just said
what are the odds?
that would have been odd. That would have got an awkward winner.
Especially if she came in and they were exes. That would have been hysterical and one for the books.
I'm going to have some explaining to do to my husband when I get home.
We cleared it up right here on the sports shop, the East Spot. We got you covered. So speaking of covered and sunscreen, that's a big debate with black skin, is whether or not we need sunscreen. Please clear this debate up for us.
I'm going to say it in 3 words. Yes, you do. So here's the deal.
Yes, you do.
Black people do get skin cancer. I've written 4 book chapters on skin of color in skin cancer. It happens. Black people are much more likely to die from their skin cancer. With that said, is that the reason? That is part of it. But let's take a look at brown people in general. Brown people also have a higher incidence of high blood pressure, diabetes. All these medications make you more sun sensitive. Brown people are in my office saying, I'm worried about my discoloration. My first question to them is, are you wearing sunscreen? If their answer is no, I'm like, once you start, we'll deal with the discoloration. You cannot expect to not have hyperpigmentation if you have high blood pressure medication, diabetes medication, and you're not wearing sunscreen.
Now, one of the big reasons I don't like sunscreen is because they look pasty or purple on my skin.
Yeah.
What products do you suggest how do we avoid that? Because that pasty whiteness is going to keep people from wearing it.
Sure. There are so many different sunscreens out there, and quite frankly, a lot of it is just trial and error. You have to find some things that work with you. The other thing I work with your skin color. The other thing I will say is different things for different seasons, different things for what you're doing. For example, if you are out playing golf or you're running and you're super sweaty, then you probably want to use something that's a little bit lighter. I like the sport blocks for those. Just don't spray them in your face, put them in your hand and apply. But if you are just getting in the car going to work, moisturizer sunscreens tend to work as a 2-in-1 product. One of the ones that I love, which is over the counter, is Aveeno because it tends to work well in my patients for people who've got darker skin. To your point, it's usually the zinc oxide that tends to look a little bit chalky, and so you do want to just go and play with it, put it on, and make sure that it's not going to make you look like a Smurf. That's not a good look.
Okay.
That's awesome. Now, speaking of Smurfs, you guys are hysterical on your social media page.
Thank you.
I had no correlation at all, except for you guys both wear scrubs. I don't know. Anyway, tell us what your social media handles and how people can stay in touch with you or even make appointments at your office.
Sure. The office number is 919-294-9440. Social media, Instagram is dr.brooke.jackson, and our Facebook is Skin Wellness Dermatology Associates. And we just do these little skits between the day. We have lots of inspiration from our patients, but we try and keep it on the positive side. But we have a lot of fun with it.
Yeah, that's awesome. So again, this is Dr. Brooke with Dr. Brooke Jackson. We had her in today for the E-Spot with Camille Cower, and thank you so much again for coming in. Well, calling in.
Yes.
And we look forward to seeing you again soon. Thanks again.
Thanks for having me.
All right, no
Have
problem.
a good day.
Yep.
You too.
Bye.
Pepsi was born in the Carolinas, and since their founding over a century ago, they've had a strong presence in the community and the culture of the Carolinas. With Pepsi Cares, they want to further their outreach and impact on the Carolinas by partnering with local organizations to make its birthplace a better place to live, work, and play for generations. Check out Pepsi Cares on Twitter, Facebook, and Instagram, or go directly to their website, PepsiCares.com, to see how you can get involved.
You want to know what's going on this weekend? Keep it locked
Yes, I
in
do.
with the E-Spot. She's going to give you some places to visit.
Have you heard the news?
Have you heard the news? Next on the Sports Shop. Let's go.
Let's go.